us as we have gone through the deliberations over the last 3 days. This morning, as you look at your program, it is quite a short program, and I'll just quickly highlight that from 9:30 to 10:30, we will be looking at the presentation of the BPF recommendations, after which we should be able to pass them on to the organ that should be able to ratify them, and ultimately they will reach the health ministers. We also have a session dedicated to the awards for the best oral presentation, poster presentation, young researcher. As we were doing our presentations over the last 3 days, we had an incognito panel of judges that was looking at how well we were doing our work, they went through the process of identifying who should be awarded. We will then proceed to having the closing remarks from our Director General, and then the official closure of the Best Practices Forum by the government of Eswatini. The conclusion of this meeting is expected at 11:30, after which the Directors Joint Consultative Committee will have their closed session. So once again, ladies and gentlemen, thank you for being present up to the last day, and it's now my singular honor and privilege to call upon Dr. Mungati, our Director of Programs at the East Central and Southern Africa Health Community, to present the recommendations. Dr. Mungati.
Good morning, colleagues. Thank you, colleagues, for making time to be with us this week and to experience the Kingdom of Eswatini. I have one very simple task, which is just to read through what we have. But before we start, I just want to add a bit more information to what Dr. Silumesi just gave us in terms of information. At the end of this session, we are going to have a networking event over tea, and that will allow us to continue connecting amongst ourselves. And after that, around lunch hour, we will have our lunch. At the end of our lunch, we'll then go for tourism, for those who are going for tourism. As the minister highlighted on the first day, please don't go away with all the money that you have in your pocket. Leave some for the kingdom. Just to go through the recommendations, ladies and gentlemen, these recommendations came from all the presentations and activities that we've been going through over the past 2 days. And this is what the team managed to capture. We are hoping that they represent what our experiences were over the last 2 days. And these recommendations will feed into implementation at country level. So it is upon us to really look at these recommendations and scrutinize them and ensure that they really represent what we want to see within our member states. I will not go into reading all of the text that is on this document. This document is 30 pages long. So that's quite a lot for us to go through in 1 hour. but I'll highlight a few things and then I'll zero in on the actual recommendations that came out. We can work through them together and perfect them before they are presented to the DJCC later today. We had 7 sub-themes. The first one was on regional health security and pandemic agreement implementation, which had 4 tracks. The second sub-theme was on digital innovations for resilient health systems, including artificial intelligence. Number 3, harnessing the demographic dividend and youth engagement. Sub-theme 4, global health diplomacy amid reforms. Sub-theme 5, sustainable financing and partnerships. Sub-theme 6, innovation, health research and development in the ECSA region. Sub-theme 7, quality of care and patient safety. We also had a special session that focused on human resources for health. You all agree with me, this is a very critical pillar of the health system strengthening. I will skip this part. I'll go straight to the recommendations. Ladies and gentlemen, the 16th Best Practices Forum requests the Directors Joint Consultative Committee to recommend to the 78th Health Ministers Conference to urge member states to increase domestic financing to strengthen surveillance, laboratories, HIV services, blood safety, and points of entry under Recommendation 1. To intensify targeted HIV prevention, early diagnosis, treatment continuity, and advanced HIV disease management. To strengthen integrated surveillance, linking health facilities, laboratories, blood services, communities, and points of entry. To strengthen laboratory networks, specimen referral, interoperable information systems, and cross-border reporting. To improve blood safety through risk-based donor screening, confirmatory testing, hepatitis B vaccination, donor retention, and linkage to care. To monitor measurable outcomes, including case detection, reporting timelines, HIV mortality, blood safety, and emergency response performance. To institutionalize specialized surveillance training for points of entry within the field epidemiology training program and other national workforce programs. Recommends that the Secretariat is directed to develop regional training standards for points of entry and facilitate training, mentorship, and simulation exercises. To develop a regional health security monitoring framework with common indicators and annual reporting. To support member states to use surveillance and program data for planning and resource allocation. To support harmonized blood safety, laboratory, and surveillance protocols. To document and disseminate best practices on health security from member states. Ladies and gentlemen, this is the time that we look at these recommendations. What comments do you have on these recommendations? Are they representative of the discussions we've had over the past 2 days? Do we need to beef up? Are there recommendations that are missing under sub-theme 1? Over to you, ladies and gentlemen. Just checking if the cluster managers have, if we can capture the discussions, please.
Thank you very much. I think it's really well drafted. On that recommendation 1, which is also well drafted, there was a discussion about reduction of reliance on patients' fees, the user fees, and diversifying other sources of financing, maybe like tax or others, to support the healthcare system. So maybe that diversity of financing and reduction of reliance on patients' user fees could be captured somewhere. I don't know. Thank you.
Thank you so much for capturing that. The team is also documenting. We'll update. Thank you so much. We need your input, ladies and gentlemen. This is our work. This is our deliverable as a conference. So we need your input. We want this to represent us because it is us who are still going to implement this, working together, of course. Emmanuel?
Thank you. Good morning. We may need to add some other diseases like the NCDs that are emerging and becoming rampant.
Thank you.
Thank you so much. Still on the same point, point one, which is increasing domestic financing. In one of the discussions, one of the breakout sessions about sustainable domestic financing, we were discussing that this should be across all other interventions, for example, maternal child health interventions, innovations in oxygen, community engagement. I feel those should also be added to the list of those diseases listed there. Thank you.
Thank you.
Thanks very much. We've had recommendations about domestic health financing or resolutions on it in previous ECSA, DJCC and regional health ministers conferences. If we are going to talk about some of this domestic health financing, I think it's important to recall things that have already been resolved, so we are not repeating them again. I think some of the options around tax financing, health insurance have been raised in previous resolutions and recommendations. So if the Secretariat could just, from previous ones, capture what has already been resolved and then bring out the new information, it will help the process.
Thank you so much. Dr. Mohammed?
I was just proposing that since we have health finance specific resolutions, why don't we, some of these shifted to that, and here in the health security, we concentrate on the increasing domestic finances on issue related to the health security.
Thank you.
Thank you, sir. I think this would be an addition. While we are also talking about increasing domestic financing, I think it's also critical for member states to consider not taxing the innovations that also help us do the disease surveillance. You'd find that we did a simple simulation where a Cobas 5800 machine that costs, say, 200,000 in China, when you import it to Zimbabwe, it adds another 40,000 in VAT and import tariffs. You import it to Nigeria, it adds another almost 60,000 in VAT and import tariffs. And these are the innovations that we need to strengthen our domestic surveillance capacity as African countries. And taxing this is taxing inbound capital. We're not taxing the productivity of that capital. We're taxing the capital itself, which means it's easier for such policies, if they're in existence, and they are in many of the African countries, to then repel the capital that helps us strengthen the domestic surveillance that we so need. The recent Ebola outbreak has really taught us the pain of the need for strengthening this capacity. By taxing these innovations and taxing inbound capital, we repel the capital that we need to strengthen the domestic surveillance. So I think we should add that member states should not tax the innovations and the capital that would help us strengthen our domestic surveillance. Thank you, sir.
Thank you.
Thank you very much. I've seen that you've indicated that hepatitis B vaccine should be reinforced, but I think one critical issue that we really need to emphasize is the birth dose vaccine for African countries, And because we all know that the commonest mode of transmission of hepatitis B is mother to child. So in as much as we are saying hepatitis B vaccine, but we should really be emphasizing on the birth dose because that's very, very critical. Thank you.
Thank you so much. Front. Emmanuel. Please go ahead.
Yes. Oh, thank you. I would like to make that healthcare financing a little bit more operable and probably broader. I have said this in one of the breakouts as well, that I think we need to deliberately finance mechanisms that actually bring in efficiency to resources that we put in place. So I would actually recommend that as probably a more effective point, because we know there is leakage because of the way we deploy our resources, the way we make our decisions, but also, you know, corrupt mechanisms corruption that happens within the systems. So I think we need to focus our healthcare financing on aspects that actually reduce that wastage.
Thank you so much. That's a twist to the conversation. The painful truth that we were not talking about. Please go ahead, Prof.
Thank you very much, and I'd like to thank the rapporteurs for capturing these recommendations. And we have 7 themes, and this is just the first sub-theme, so I'm getting a bit nervous at how many recommendations we are going to have, because, and we are recommending to member states and ministers and director generals. So is it possible for the Secretariat to craft and see areas of overlap? Because sub-theme 7 is also talking about financing, so most of those issues around financing, and we really want financing across board. If we're going to build health security and resilient health systems, we need domestic financing across board. And so maybe those would be captured under sub-theme 7. Now, when I look at recommendation 1, recommendation 3, and recommendation 4, they could actually be consolidated, because it's all about strengthening, and I see One Health surveillance has dropped across the board, but really it is strengthening collaborative surveillance, laboratory networks, and 1 and 3 and 4 could actually be consolidated into 1. And then what has dropped out is, under this sub-theme, is this whole failure for us to have products, health products for health security. The capacity of the region in R&D and manufacturing our own products. The blame is on us every time to think that it's others who have not developed for us products. We should develop our own products, and I think we need to capture that recommendation so that this goes to member states and say, our failure to have a vaccine for Ebola is not because of somebody else. It's because we didn't invest anything in. So I want to see a recommendation on that. But sorry, I'm told I've been talking to myself. Is that true? Oh, let me go over this again. Sorry, I'm really sorry about that. I was saying that we have 7 sub-themes, and so we really need to be careful that we don't end up with, if I look at the first sub-theme with 7 recommendations, 7 times 7, you're going to end up with over 60, 50 recommendations is a bit overkill for the minister. So for the first sub-theme, I was saying recommendations 1, recommendation 2, and recommendation 4 can be consolidated into 1 recommendation and broadened into issues around collaborative One Health surveillance, strengthening laboratory networks across health security and resilient health systems, and whatever communicable diseases, everything, including sickle cell disease that was articulated. So that then we don't see the other things missing out, that under this area, for example, I would like to see a recommendation on strengthening capacity in the region for R&D and regional manufacturing, so that we have products that we can deploy when we have outbreaks or epidemics, vaccines, therapeutics, and diagnostics, but that will require us to build capacity for R&D and manufacturing, and that the message goes to our member states that the failure to have these products is not because of anybody else, but us as member states. Thanks.
Thank you so much, Prof. That's why we have you in the House, because we really need this realignment so that we have focused documents that can then be utilized by the target population, which are the ministers. Thank you so much. I do not see any additional hands. Can I request my team if there are reactions to the comments that have been raised? Thank you, Dr. Mohammed, for reacting. Oh, there's a hand here. Emmanuel? Yeah. My team, if there are reactions.
Yeah, thank you. Thank you. We had a discussion around the multiple macronutrient supplementation, and all the commentation I can see is not featured. Probably it has been hidden somewhere, but because it's a very unique and a new development, it was under quality of care. I think it should be, I suggest we may put some statements around it so that we get some reactions from the ministers, and it's one of the program which needs their support for it to accelerate. Thank you.
Thank you so much. So our recommendations are following the sub-themes that we had. So we are currently at sub-theme 1. That's where recommendation 1 is coming from, which focuses on strengthening health security. So your MMS, I know it's there, down there, you will see it.
Thank you,
But thank you for reminding us of these innovations. After all, this particular conference introduced the innovations market. We can't get away without talking about them. There's a hand behind you, Manuel.
I have also a microphone here.
Please go ahead.
I just want you to guide the audience. We are making recommendations from the presentations that were made, from what we have listened. I think to avoid bringing any idea we may have, I think we need to guide. Otherwise, we have so many things in our heads. But I think there must be logic from what we have has been presented, what we have discussed, not everything. Maybe you could guide on that.
Okay. Thank you. Thank you for raising that.
Thank you so much. We have been talking about disease knows no borders. I think somewhere where we were talking about the ports of entry and surveillance, I would suggest that maybe we strengthen also the issue of cross-border collaboration and also have terms of reference, because as it is now, it's just an ad hoc response. I'll make an example of the outbreak of vaccine-derived polio between Botswana, Namibia, and Angola. They're just responding, but honestly, there are no SOPs to say after that who does what, and what are the guidance that are getting from our ministers. Sometimes you can see that you can go, the surveillance can go to the other side of the border, but there are no clear SOPs as to who's supposed to do what. Is it me where's the where the disease started from my side, or is the other person where the disease might go beyond that border? So I think that we should also add in the ports of entry within the trainings. Thank you.
Thank you so much. Any reactions from the ECSA team? Manuel? We have a comment this side.
Thank you so much. I was wondering whether maybe from the start we should agree on how many recommendations we need to make to the ministers so that we are guided. Say if we say 10, we'll be able to see which theme can have 2 or 3 maximum. Otherwise, if we leave it open-ended, I think we'll be repeating what has been recommended in the past, as the previous speaker said. Thank you.
Thank you so much. I stand guided, DG.
Thank you very much. I think those comments are very pertinent. So 2 to 3 per sub-theme. Yes.
Thank you, DG. There is a suggestion, 2 to 3 recommendations per sub-theme. Are we in agreement? There are responses on this side, there's silence on this side, there's silence there. We need to agree. What happened to the other mic? We need the mic in here.
Thank you, Program Director. I'm suggesting that we let you present all the recommendations, and we trust that you'll be able to collapse to 3 per area, because I think, as already alluded, that we are all with different thoughts and from different schools. So we trust that you have done a good job. Then probably we can identify areas where you didn't pick up something that we think is pertinent as a recommendation. Thank you.
Thank you so much. Any opposition? In the spirit of democracy. Thank you so much. With that, I'll move to recommendation number 2. We take note of all the comments that are being raised and the guidance as well coming from the audience. This is our work. We have to do this together. Under recommendation number 2, scaling One Health antimicrobial resistance action for lasting impact in the ECSA region. The 16th Best Practices Forum now therefore requests the Directors Joint Consultative Committee to recommend to the 78th Health Ministers Conference to urge member states to, number 1, align, accelerate, and finance implementation of national action plans with the Africa Union Framework for Antimicrobial Resistance Control 2026 to 2030 and previous ECSA Health Community resolutions. To set national baseline and time-bound targets, publish annual implementation and financing progress, evaluate high-impact interventions, and scale approaches that demonstrate effectiveness, equity, and value for money. 3, to strengthen and scale up integrated antimicrobial resistance and antimicrobial use surveillance through quality-assured laboratory networks, quality specimen referral systems, rapid diagnostics, interoperable information systems, and timely national, regional, and global reporting. 4, to translate evidence into clinical and public health action by updating treatment guidelines, procurement forecasts, and essential product lists. 5, to improve equitable access to antimicrobials and self-reliance through regulatory harmonization, pooled procurement, resilient supply chains, technology transfer, local manufacturing, research, innovation, and specialized workforce development. Recommends that the Secretariat is directed to 1, establish a regional antimicrobial implementation monitoring and accountability framework aligned with the Africa Union Antimicrobial Resistance Framework 2026 to 2030. 2, to support sustainable implementation and financing of national action plans. 3, to coordinate regional technical assistance, capacity development, and data integration. 4, to facilitate interoperable regional antimicrobial resistance, antimicrobial use, laboratory and supply chain digital systems. 5, to promote routine use of evidence to inform clinical guidance, procurement, outbreak detection, investment, and policy. 6, to document, evaluate, and disseminate implementation models and country best practices and report annually to the Directors' Joint Consultative Committee and the Health Ministers' Conference on progress, financing gaps, outcomes, and recommendations for corrective action. There you are, ladies and gentlemen. What say you? Must be a switch underneath.
Thank you very much, the presenter. And I'm still in the spirit of sticking to the sub-themes for this best practice. And I'll be candid that I know that the Mauritius Best Practice Forum was focused on antimicrobial resistance. We made a lot of recommendations. So like the colleague said, if we had a recall of what we made in Mauritius, then we would craft this, because all AMR at this forum was under health security and IHR. It was not a standalone sub-theme. If you look at the 7 sub-themes, AMR doesn't stand up a sub-theme for this. But it was, and I recall in Mauritius, we made so many recommendations. A couple of them actually are captured here. And if we went to looking at how many where are we with respect, for example, to the national action plans, every member state, I mean, we have 90%, 98% almost member states having national action plan for AMR. But the funding has not come. The challenge is really for us to say, what do we tweak? We have the plans. Where is the challenge for us to get the money to implement those plans? Because the issue now is not really recommended to have plans, because almost every member state has a plan. But the challenge is really to go above that and say, how do we mobilize the funding to implement the plans, which would be just one recommendation for me for this area for this year, because there were so many in Mauritius.
Thank you. Thank you. I'm actually looking.
So it's a follow-up to the recent comment. I think as ECSA, we need to develop a tool that helps us track these recommendations, how they are being implemented, and whether or not there is need, where we are now saying we are coming in for the next ECSA BPF. We then go back to say which of these recommendations are trailing behind so much that they need to be pushed into the following year. I think if we do that, we'll avoid a lot of duplication in terms of coming this year, we make recommendations, then we come next year, we make the same recommendations, and then we come the year after, and then we make the same recommendations. I think this should help for us to just develop a tool. As Africa Clinical Research Network, we are happy to suggest some of the ideas that we have seen being used in some of the different countries and in some of the different forums as well. So this is something that I feel would help alleviate some of the issues that the previous speaker has just reiterated on. Thank you.
Thank you. I'll request 2 of my colleagues to react directly to those 2 comments.
Okay, thank you very much, Dr. Moore and Prof. Talisuna. We are well guided. We should be able to collapse the recommendations into one. And true to your word, I think the biggest challenge in terms of implementation of country national action plans actually lies in financing. All of them have plans, but none of them have been able to secure predictable or sustainable financing. If that is unlocked, hopefully all the other resolutions will be made. And to speak to the second comment, I think the monitoring framework is going to be critical, so that at every BPF or HMC, we can be able to monitor on progress, and that will help solve the issue. And also to the other aspect that you made in terms of the AMR being part of the health security sub-theme, we will work on that to make sure that they actually all fall under the same sub-theme. Thank you.
Thank you, Eve.
Okay, to respond to the second question, yes, as ECSA, it came up from the advisory committee and the HMC that we need to monitor the resolutions that we have passed over the years. So last year we did, and the report was shared at the Health Ministers Conference. So we noted that even in the upcoming years, we also have to share the report during the DJCC. But the report is there now, monitoring what is happening, the implementation across all the member states with regards to the resolutions. Thank you.
Thank you, Sebe. Any other comments? Thank you. We move to recommendation number 3. Digital innovation for resilient health systems. The 16th Best Practices Forum now therefore requests the DJCC to recommend to the 78th Health Ministers Conference to urge member states to 1. Accelerate integration and interoperability of national digital health systems by strengthening electronic medical records, laboratory information systems, surveillance platform, and digital points of entry. 2, to adopt common standards for data governance, interoperability, cybersecurity, and real-time information sharing to enhance preparedness, cross-border surveillance, and international health regulations compliance. 3, to institutionalize data-driven and AI-enabled decision-making by integrating real-time analytics, predictive modeling, and AI into clinical practice, surveillance, program monitoring, commodity management, and emergency preparedness to strengthen health system resilience. 4, to increase sustainable investment in digital health infrastructure, workforce capacity, and innovation. 5, to adopt a national AI in health policy and regulatory framework aligned to the World Health Organization and Africa Union guidance. Direct the Secretariat to 1, provide technical assistance to member states in developing interoperable digital health platforms and harmonizing digital health standards across the ECSA region. 2, to facilitate regional knowledge exchange by documenting and disseminating best practices in digital health to accelerate adoption and scale up. 3, to mobilize financial resources to support member states in implementing sustainable digital health innovations. Colleagues, let's discuss. I know we don't have many youths in here, but let's discuss. This is the real world now. DG, maybe we should have had a youth component to this conference. They would understand these things better. Yes, there's a hand there.
Thank you very much, Doc. Just a very quick addition. I just wanted to add that there's also maybe an opportunity to say something about AI being able to increase the educational frameworks, because I think, especially where there's a shortage of specialists in certain areas where there may not be educational reach for the patient populations, I think there's an opportunity to implement AI into the educational aspect of things.
Thank you for that.
Thank you. My comment is around the use of data for decision making. My name is Ambrose, I work at Wikasola. One of the challenges we face as partners is where much as the improvements in the use of digital platforms is the access to this information to be able to improve programming and implementation. So access becomes a challenge. How does that be incorporated to some of these recommendations?
Thank you so much.
Thank you very much, Program Director. Mine, I think, is different. What is my thought is that probably we have a table which shows the recommendations that we did in Mauritius and show the status of implementation as to where we are as countries. Then from there, we will be able to pick up what was left, then add what we have discussed here. Thank you very much.
Thank you so much. In the spirit of quality improvement, we acknowledge and accept that recommendation.
Should I go on?
Please go ahead, sir.
Yes, my name is Mark from Pima Raj, Tanzania. My take on this, I would like people to, the member state to align with the international standards, like the SINOMED, during the interoperability, like the SINOMED, Systemized Nomenclature of Medicine, Link, Logical Observation, Identify names and codes when exchanging lab results or something, but also we like to see how we could do with the continuum of care between regions, the introduction of IPS, the International Patient Summary, but also we have tools like the digital health wallets that could cut across on this and see how we could align with, the, for example, the WHO Global Digital Health Certification Network, and see how better we could do all the things. So for me, I think there's a way to go, and to see how we could, you know, like engage on each other to see how better we could make the digital health go further. Thank you very much.
Thank you so much for that input. We have exhausted. Thank you. Recommendation number 4, harnessing the demographic dividend through youth engagement. The 16th Best Practices Forum therefore requests the Directors' Joint Consultative Committee to recommend to the 78th Health Ministers Conference to urge member states to track and fulfill their commitments made during the Regional Youth Summit communique aimed at bolstering efforts leading to harnessing the demographic dividend. 2, leverage on the school environment to foster healthier behaviors and lifelong health by strengthening the national school health programs through better coordination between the Ministry of Health and the Ministry of Education, promoting better nutrition, increased physical education, and expanded adolescent-friendly medical services. 3, to institutionalize the Global School-Based Student Health Survey, GSHS, to ensure periodic data collection to allow for monitoring of trends among learners and provide the robust evidence needed to guide future school policies and programs. 4, to ensure male engagement strategies are formally incorporated into National Early Childhood Development, ECD, and maternal child health policies across the ECSA member states. This institutionalizes paternal involvement as a standard component of regional health frameworks. 5, to give due consideration to the position statement of the ECSA College of Obstetrics and Gynecology Community of Practice on sexual and reproductive health and rights for possible adoption. Directs the ECSA Secretariat to 1, support countries to implement commitments contained in the Regional Youth Summit communique made during the ECSA Regional Youth Summit held in the Kingdom of Eswatini in January this year. 2, to support countries to implement the Global School-Based Student Health Survey to ensure policies targeted at addressing the health and well-being of adolescents are data-driven and remain relevant and effective. 3, to develop standardized training toolkits for male engagement for use in early childhood development and maternal and child health programs across all ECSA member states. 4, to facilitate consultations and further engagement with the relevant stakeholders on the position statement of the ECSA College of Obstetrics and Gynecology Community of Practice on sexual and reproductive health rights. Now we are back to the youth. Are we in agreement? Did we falter somewhere? Did we miss something?
Thank you so much. I think my observation also applies to other submissions. I think
some countries made presentations, but there are others who are also doing exactly what they are doing. So my observation is that instead of coming out as if other countries are not implementing maybe similar programs, we can maybe add, for example, number 3, institutionalize or strengthen, so that we take cognizance that there are other countries who are also implementing the same intervention, only that they didn't present. Thank you.
Thank you so much for that input. It speaks to landscape analysis, and I'm looking at the focal point for us. Is taking note of this. Thank you so much.
Good morning, everyone, and thanks for that. I think there's a reference to, there's a recommendation referencing a statement of the gynecologists in respect to SRHR. So my question is whether it's going to be annexed or whether we actually need a very stronger, formidable recommendation that kind of summarizes what the gynecologists are saying. But also in the framing, I felt the language is a bit too careful to give due consideration, which is good, and then the last 2 words, possible adoption. I think if you give due consideration, then you should really get into adopting. I felt it's too careful, and we really want to move forward adopting, not possibly adopting. Thank you.
Thank you. Thank you for that.
Thank you very much, Chair, and thank you for the submission. Indeed, the position statement will be made available as an annex so that as the DJCC considers this submission, they actually make reference to the statement. It's interesting to see that you noticed the carefulness about the wording. We take note of your submission, but really it's in recognition of the fact that these are not very easy issues to navigate, so you really want to maximize on the consultations before the agreement is arrived at. Thank you.
Thank you, Dr. Silumes. Is the hand up, sir? Is that a hand up? Oh, okay. I was hoping you'd say yes. Thank you, colleagues. We now move to recommendation number 5, fostering global health diplomacy amid reforms. The 16th Best Practices Forum now therefore requests the Directors' Joint Consultative Committee to recommend to the 78th Health Ministers' Conference urge member states to 1. Ensure global and bilateral agreements protect fundamental principles of legally enforceable benefit sharing around data, genetic material, and other health resources. This speaks to the comment that was raised earlier. 2, to enhance access to health technologies and the means to develop them explicitly, not overriding national laws and regional agreements, nor making health agreements or aid conditional on other resource concessions. Urge ECSA Secretariat to 1, strengthen regional coordination and technical support to member states in global health diplomacy, including development and coordination of common regional positions on issues affecting health security and equity. 2, to facilitate knowledge sharing and capacity building amongst member states on the governance, protection, and responsible use of population data, genetic and pathogen materials, biological resources, surveillance, and outbreak information. 3, to facilitate engagement with relevant regional and global platforms to promote equitable access to health technologies, fair benefit sharing, and health. Quite brief. There's another hand at the back.
Thanks very much. I think in the sentence which says, urge the ECSA Health Secretariat, given that we are shifting so much from global to also bilateral, can we please just insert the words strengthen regional coordination and technical support to member states in global and bilateral health diplomacy? Because that's where we are finding a lot of the problems taking place. And then the final point on benefit sharing and health, I think it just ends a bit weirdly. So perhaps there's a word missing there. I'm not sure what is being said there, to be honest, from the Secretariat. So perhaps that can be clarified, because I think it's equitable access to health technologies, fair benefit sharing, and health resources, or health technologies, or... No, but that's already stated. It's unclear. I think that sentence needs to be clarified.
Well, thank you for picking that up. We'll cross-check and revert. And we take note of your other comment around bilateral agreements. Thank you for that. This is exactly why we want everyone to see this, so that what goes to the DJCC and eventually to the ministers really represent what we want to see. Please go ahead, sir.
Thank you, Chair. Emmanuel Makasa from Zambia. Engagements on global health diplomacy engagements will require diplomatic capacity within the region and within the ministries of health. We cannot negotiate anything we have put in that text if we don't have the capacity to negotiate diplomatically ourselves. ECSA had started a global health diplomacy capacity building program in the past. And unfortunately, by about 2017, this started falling apart, and since then, we've not really been doing any capacity building with our member states, even as we did it before. We were preparing our member states before any multilateral engagements at the UN and other fora, so that our member states understand the agenda, they understand the position of the different actors, and also they can take a joint position that then we advance as Africa or as ECSA or SADC. And so in this decision, I don't see anything in there that speaks to building our capacity to be able to negotiate. If we leave out that, I doubt that we'll achieve anything that we are putting in that text. So I urge this forum to consider a line that speaks to us reactivating the capacity building within our region. We do have the diplomats and we have the teachers. We just need to engage, because our ministry technocrats are technocrats. Not all of them can diplomatically engage. So we must build that capacity. Thank you.
Thank you so much. These are lessons from the field. Thank you so much for giving this input. What I'm excited with your statement is the fact that as ECSA, we have actually started discussions around ensuring that there is that capacity building being built. The question is how. So we'll continue updating you on the progress on that. Thank you for highlighting these gaps.
Okay, thank you very much. I'm not very sure whether what I'm thinking is contained in point number 1 regarding that collective negotiations as a region when we are dealing with the ongoing PABS discussion in the region, and the fact that member states were bilaterally engaging, and we felt like we didn't consult enough within the region, so that at the end of it, it doesn't look awkward that your neighbor is signing the MOU and the other neighbor is not signing the MOU. Is it contained in that first sentence?
Yeah, I think that's what Reni was talking about, that we didn't really include bilateral engagements in this particular statement. So that's a revision that we're going to make.
Thank you very much.
I take note of your point, the experiences that you've had with the bilateral agreements. All right, we move to the next recommendation, number 6, innovation, health research and development. The 16th Best Practices Forum requests the Directors Joint Consultative Committee to recommend to the 78th Health Ministers Conference to urge member states to 1. Invest in health research and innovation through sustainable financing, strengthened ethical and regulatory processes, appropriate infrastructure, and workforce development. 2. to accelerate the adoption and scale-up of proven health interventions using national and regional evidence where sufficient implementation evidence already exists. 3, to institutionalize and operationalize health impact assessment within the national development planning by strengthening capacity, operational guidelines, and multi-sectoral collaboration, thereby advancing the One Health agenda. 4, to scale up proven high-impact health innovations across the region, including but not limited to MMS and Impala. Directs the ECSA Secretariat to 1, continue providing technical support to member states on research, workforce development, quality-assured laboratories, digital systems, and harmonized ethical and regulatory processes. 2, to support member states to operationalize past resolutions on health impact assessment by facilitating cross-country learning and multi-sectoral collaboration and monitoring implementation progress. 3, to support member states in accessing, adapting, and implementing validated best practices and health innovations within their national health systems. 4, to take steps to develop a roadmap to more comprehensively operationalize the Regional Health Ministers' Conference resolutions on health impact assessment. 5, to facilitate regional knowledge exchange, technical assistance, and resource mobilization to support member states in scaling up MMS, MMAMA, SBBC, Impala, and other proven innovations, including through documentation and dissemination of implementation practices. These are the innovations, colleagues.
Thanks very much. I'm presuming that in the background there has been some reference to the prior RHMC resolution on the health impact assessment so that we are reminded of it. But I think in the first, in point 3, under urge member states too, could we say thereby also advancing the One Health agenda? Because actually it also advances other areas of economic diplomacy, etc. So I think it's not only One Health that we are advancing when we do this. So just to be comprehensive about it, we don't have to add all the other things that it advances. And then finally, in the directs the ECSA Health Secretariat, if you could just scroll down, I think point 2 and point 4 could be converged. I think they are pretty much talking about the same thing. So we could put those into one common point because it's talking about operationalizing past resolutions on health impact assessment by, and I think we could say support member states to operationalize past resolutions on health impact assessment by developing a roadmap, because that sentence 4 basically repeats what's in sentence 2, by developing a roadmap and facilitating cross-country learning, etc., etc. So I think we can make it a little bit easier to read. Thank you.
Thank you so much for that guidance. We'll take note of that and include in the revisions as we reduce the number of recommendations as discussed earlier.
Hello. Yes, point number 5. This word mama. I don't know whether everyone knows what is mama here. And so I know what it is myself, but I don't think that that word should be used because just a word, just a brand name for a particular organization or a program going on somewhere. So I think it should be replaced with the universal word or name that everyone can understand. And I would propose emergency transport for maternal mothers, but not mama. That one should be removed, that completely.
There's a reaction there. Thank you for the input. We take note of that.
Unless because I know the organization that is spearheading MMAM, unless they have sent you to put it here.
Thank you very much for this recommendation. With respect to R&D and workforce, I saw it appears in the recommendation to the member state. I think we need to be a little bit explicit here because the challenge really is to create that critical mass of scientists who can drive us from R&D to industry. And this will require curriculum reviews and creating courses at universities. And so when we just blanket it as workforce development, it doesn't speak to what is missing. Because really to be able for us to move, even create a critical mass of R&D gurus, the people who replace the next Pontiano Calebus of this world, the ones who are doing this high-level research, and then the industrial scientists who are going to create these industrial hubs or that are going to drive manufacturing is missing. So it's not really general workforce development. So I think we need to be explicit about that so that member states can do that, making sure that curriculum reviews are taking place. I know, for example, Amref University in Nairobi is trying to create this kind of curriculum, but it will require other member states to do that. And then for the Secretariat to mobilize some kind of catalytic funding to drive some of these things. I mean, curriculum review doesn't require so much money sometimes. So, but if we are driving that curriculum review across the region, then really it's not one country doing it, but it's kind of we are learning from each other. So I don't know how we can phrase it, but I think we need to phrase that workforce development differently from the normal workforce development that we normally do. Because this is a different caliber of workforce that we want to have in the region.
Thank you so much, Prof. There's a comment.
Apologies, it's actually a comment which maybe relates across all the recommendations, because in some places we are specifically naming projects or partners, and in some places we are not. And I think we need to be a bit consistent. If we are talking about for example, directs this extra secretariat to, if it's working with a partner, to name it or to not name it, or a project to name it or not name it. And if we don't name them, then we need somewhere a generic resolution, maybe down at the bottom, to say, to support the partnership in implementing these resolutions and in scaling up relevant interventions in the region, so that we are not being inconsistent in how we do things. Because sometimes it might look like we are promoting a particular institution, and I'm not sure that's a correct strategic thing to do. We need to have our door open to learning a bit more widely. So I'm asking the Secretariat to being a bit careful about consistency in naming and not naming across the resolutions. Thank you.
No, thank you for that.
Thank you so much. I think I agree with the previous speaker. If we specify technologies, it means maybe we're promoting one or two technologies, but there would be more technologies. So I would suggest that those could just be cited as an examples rather than black and white that this technology. So that there should be room to have other innovations rather than be limited to one.
Yeah. Thank you so much for that. All right, thank you. Recommendation 7, strengthening the quality of care and patient safety through integrated, people-centered and data-driven health systems in the ECSA region. The 16th Best Practices Forum requests the DJCC to recommend to the Health Ministers' Conference to urge member states to, number 1, establish or strengthen nationally owned quality of care and patient safety policies, standards, and implementation plans across the continuum of care. 2, to institutionalize quality improvement capability across all levels of the health system through competency-based pre-service, in-service, and postgraduate education, leadership development, training of trainers, blended and practice-based learning, and routine coaching, mentorship, and supportive supervision. 3, to strengthen data systems in the integration of mental health and psychosocial support into HIV, sexual and reproductive health, maternal and child health, and primary health care services. 4, progressively replace avoidable disease-specific silos with integrated patient-centered chronic care models for HIV, hypertension, diabetes, and other long-term conditions at facility and community levels. 5, integrate early screening, detection, referral and quality assured management of congenital conditions into maternal, newborn, child, and community health platforms. 6, to adopt interoperable national digital systems for monitoring complete service cascades across community and facility settings. 7, institutionalize Ministry of Health-led country monitoring dashboards for self-care and other cross-cutting quality priorities. 8, to accelerate safe, quality-assured introduction and scale-up of MMS within antenatal care. Directs the ECSA Secretariat to 1, provide technical assistance to member states to institutionalize national quality improvement capability. 2, to facilitate regional guidance and peer learning on integrated service delivery models. 3, to support member states to establish interoperable privacy-preserving digital monitoring systems and harmonize minimum data sets that link community and facility services with national HMIS and logistics systems. 5, coordinate regional adaptation and institutionalization of the country monitoring dashboard for self-care. 6, to develop regional technical guidance for safe and sustainable MMS introduction and scale-up. 7, to mobilize and coordinate technical and financial partners. We take note of your comments on specifics, MMS. Any reactions?
Thank you so much. I think I've seen a repeat of digital health and also MMS here, which can fall under the other sub-themes we've already discussed. Thank you.
Thank you. We'll take note of that.
I would like to talk about the interoperability. As I've seen, a lot of interoperability that's been spoken here is about the system to system. You know, we haven't gone to the Internet of Medical Things. For example, the Impala that they were talking about, you know, it captures the vitals. So we would like to have frameworks that could to establish interoperability frameworks for integration with the Internet of Medical Things. For example, capturing vitals straight from the digital devices. Thank you.
Thank you. Thank you.
Thank you, the Secretariat, for these recommendations. Again, I think in the spirit of the way we started, eight recommendations for this sub-theme. Is it 8 or is it overkill? But we'll see how we can consolidate some. I think quality has been an issue, and I think it is nice to see recommendations on quality across board. But I think what is falling through the cracks in this area is really safety. And I raise this because one is we are having a lot of issues around quality of the training, so that there is likely to be issues around safety of care itself in terms of the people who are giving care. But also the second issue is that with new products coming across, we really need strong programs that monitor the safety of the products that are out there, medicines, vaccines, and diagnostics. We had a talk here about supporting medicine regulatory agencies to reach certain maturity levels. And I'm raising this because I think issues around pharmacovigilance, post-marketing surveillance always drop through the curve. And I don't know how we craft a recommendation to do this. Might have not been presented here, largely because maybe MRAs are not in this audience and we need to be bringing them on. But I really think that we need to be strengthening the capacity of MRAs to track the safety of products that are out there on the market, and that the dashboards and standardizing these maturity levels of MRAs across the ECSA region is really going to be a good practice. I think Zimbabwe is the highest now in this region, but it's really good that countries then benchmark themselves, and we will be then sure that the safety of the products that are on the market across the region are good. The second point, and I really like the issue on recommendation number 3, and I would flip that to start with strengthening mental health and psychosocial support systems across, because we've seen this in health security. I mean, COVID-19 affected everybody. I was in Ndola during the response, and health workers are depressed, but even families touch everybody. And yet, if you look at mental health and psychosocial support programs, first of all, the cadres to give these are orphans. It's an orphan group area. We don't have mental health and psychosocial support experts. And for us to deliver this, we really need to create that pool of people who can give mental health and psychosocial support care, but even mental health and treatment itself, and ensuring that some of the mental health medicines that we want on the essential lists of the countries to be delivered at primary care. So I capture this, but I think I like this, but we should be more broadened, and I like the end of the primary care. A bit of it should have been the beginning, and then we focus on HIV, AIDS, but because it's affecting everybody across the board, and I think it is something that ECSA can drive. But the key point that I want to raise here is that safety is falling through the cracks most of the time, and we really need to craft a recommendation that ECSA and the member states can take on safety. Thanks.
Thank you so much, Prof.
Thank you very much. And my comment is in response to the previous speaker. I think we need to strongly have a recommendation on the safety based on the person providing the care. I think it's becoming a bit difficult when people start not trusting the providers. And he mentioned about training. I think the quality of training is really having trouble arising from the private institutions who are training our health providers. And I think the recommendation should be on strong regulatory frameworks, so that we are able to these institutions are able to provide, to have graduates who are fit for purpose. And I think once we don't have a strong recommendation regulation, we may continue talking about safety and quality, but neglecting the person who is providing the care. Thank you so much.
Thank you so much for really beefing that up.
Yeah, for number 4, when we discussed this disease-specific silos and integration, we talked about HIV, hypertension, diabetes, but for other long-term conditions at facility and community levels, it should be based on evidence. It's not just combining anyhow. And we gave examples where it could be counterproductive. So I think we need to add based on evidence. Not every long-term condition should be combined. Yeah? I don't know whether you get...
Yeah, fully understand. Thank you so much.
Thanks very much. Yeah, my comment was on the exact same thing. I was going to say that yesterday it was discussed that it might be counterproductive for, say, chronic cases of TB, where it would be very counterproductive to have integrated clinics where patients infected with TB are housed together with patients not infected with TB. That would be quite problematic. So it was just on the same comment that we could be maybe slightly more specific with which long-term conditions and possibly those with similar underlying pathophysiologies. Yeah.
Great, thank you so much. Great. All right, are we hungry? Our hands are down more than up now. Recommendation number 8, scale up sustainable financing and partnerships. The 16th Best Practices Forum requests the Directors Joint Consultative Committee to recommend to the 78th Health Ministers Conference as follows: to urge member states to 1. Strengthen domestic resource mobilization through innovative financing mechanisms. 2. To scale up sustainable financing models that strengthen primary healthcare, including direct health facility financing, integrated social health insurance, and financing mechanisms that protect poor and vulnerable populations. 3. To institutionalize interoperable digital public financial management systems to improve transparency, accountability, expenditure tracking, finance reporting, and evidence-based decision-making. 4. To allocate sustainable financing for the operations, maintenance, and lifecycle management of critical health infrastructure, medical equipment, and digital technologies. 5. To strengthen community participation, leadership capacity, research, public-private partnerships, and equitable governance to enhance accountability, ownership, and resilience of national health systems. To direct the ECSA Secretariat to 1. Facilitate regional exchange of best practices and lessons on sustainable health financing, including direct health facility financing, digital expenditure tracking, social health insurance, community financial models, and innovative public-private partnerships. 2. To provide technical assistance to member states in developing and implementing sustainable health financing strategies, domestic resource mobilization frameworks, and digital public financial management systems. 3. To promote regional collaboration, South-to-South learning, and equitable technical partnerships that strengthen health financing, leadership, research, and health system resilience. 4. To support evidence generation, documentation, and dissemination of innovative financing models to inform policy development and investment decisions across the region. 5. To monitor and report progress on implementation of this resolution during subsequent Health Ministers' Conference. There we are, colleagues.
Thanks. I think this is an area where ECSA could look at what we resolved and put for in previous meetings, because I think there is definitely repetition. For example, point 1, I know has appeared in previous recommendations and resolutions. So I guess the question is, where there have been previous recommendations and resolutions, maybe we need something which says urges member states to operationalize and report on implementation of prior ECSA resolutions and any barriers or constraints, etc., or something that actually reminds us of them but also not repeats them and tries to move from the statement to the practice. I would just like to recommend that, because I think across a number of them, there are a number of those recommendations, they are already there in prior conferences.
Thank you so much. That also builds on the comment that was made earlier around creating a table which shows what resolutions were made, what progress has been made, and how that then filters into the current recommendations.
And that actually was something that was also done, I think, as the Secretariat noted in prior conferences. So, but that applies to all the recommendations in a way. Thank you.
Thank you so much. There's a hand there.
Thank you very much. Mine is just a comment and an addition that probably in these statements, if we can try and improve on our language, where we will try to put in factors where we want to demonstrate the efficiency in the use of the resources that we have, so that our advocacy to strengthen the increase on the mobilization of resources falls in acceptable ears through our colleagues from finance, because from where they stand now, they do believe that they are allocating fair share of resources. So we really need to demonstrate that we have pillars that talks to efficiency into utilization of the resources. on top of that, then we are asking for more after showing the demonstration of the use of those resources. Thank you.
Thank you so much. Very good point. I thought we would have more comments around the money. All right, thank you, colleagues. We move to the next recommendation, number 8. Establishing a regional health workforce planning, absorption, specialist training, and mutual recognition compact. The 16th Best Practices Forum now requests the DJCC to recommend to the 78th Health Ministers Conference as follows. Urge member states to 1. Establish by 2028 an interministerial health workforce planning and absorption compact led jointly by the Ministries of Health, Education, Finance, Public Service and Labor with participation of regulators, employers, professional associations, ECSA constituent colleges, training institutions and the private sector. 2. To undertake and periodically update health labor market analysis, needs-based staffing standards and funded workforce plans. 3. To increase and protect domestic financing for health worker education and employment. 4. To formally recognize and support ECSA College of Health Sciences fellowships and constituent college qualifications within the national education, professional registration, employment and remuneration frameworks. 5. To expand quality-assured specialist training beyond university teaching hospitals by accrediting suitable regional, district and faith-based and private facilities. 6. Strengthen the national competent authorities, professional councils and education regulators to apply common competency-based curricula, accreditation, examination, licensing, continuous professional development and professional conduct standards across the public and private institutions. 7. To operationalize reciprocal or regional mutual recognition arrangements for qualified health professionals aligned with East Africa Community, SADC, and continental frameworks. 8. To institutionalize gender-responsive and inclusive workforce policies that improve recruitment, training completion, leadership, safe workplaces, and career progression for women, persons with disabilities, and underrepresented groups. Directs the ECSA Secretariat to 1. Develop with member states and partners a model regional health workforce planning and absorption compact. 2. To establish a coordinated ECSA regional mutual recognition and accreditation system with national competency authorities, professional councils, ECSA College of Health Sciences, East Africa Community, Southern African Development Community, Africa CDC, World Health Organization, AFRO. 3. Strengthen the governance and resourcing of ECSA College of Health Sciences and its constituent colleges. 4. Coordinate regional health labor market studies and an interoperable minimum HRH dataset covering training, graduation, licensing, vacancies, employment, deployment, retention, migration, and specialist distribution. 5. Mobilize sustainable financing and partnerships for scholarships, faculty development, accreditation, simulation centers, digital and blended learning, leadership fellowship, and expansion of specialist training. 6. To facilitate South-South learning and technical assistance on workforce absorption, decentralized recruitment, rural retention, regulation of private education, national competent authorities, mutual recognition, gender-responsive career pathways, and effective collegiate and fellowship models, and document transferable practices and implementation lessons. Quite a mouthful. This touches on us as well. We are also health workers.
Thank you, Doc. This is a recommendation on the recommendation 7, operationalize the reciprocal and regional mutual recognition. I think we should also add to that the ease of mobility for clinicians and all of these research staff, because going into mutual recognition of the qualifications without acknowledging the difficulty or implementation in reality that across multiple African countries, we still require visas for each other. So to simplify the movement and mobility of the critical health staff would be probably a critical addition to that recommendation, to make sure it's holistic. One, in making sure that we acknowledge and there is that mutual acknowledgement of the qualifications, but also simplification of the mobility of these staff who are qualified to then go into the different countries and assist, whether it is with pandemic response or for clinical studies and things like that. Thank you.
Thank you so much for raising that point.
Sorry, but I've seen the word interoperable integration have been used more frequently in this document, and I think I want to give a difference between the two. You know, when you speak about the interoperability and integration, I just want to say it so that you could see how you could use them in our document. Integration, for example, we came here and I speak Swahili and somebody speaks Zulu, but you put somebody in between, third party, to translate what you've been talking. That is integration. But interoperability is when you agree on the certain standards. That right now, both of us speaks his or her own language, but we agree that now we are speaking English. So that's interoperability. So that's why, for me, I think in the health sector, we need to have something like a federated regional health information exchange, that we standardize things so that the exchanges, will be agreeable. For example, if you have a health information exchange that have the master patient index, that's a unique identification of a client. You have the shared health records, is where the continuum of care comes in. You have the terminology services, that's where you agree on which standard are you going to use, but also using the fire standards, where you could exchange. It accelerates the interoperability. So I just wanted to put that clear, so that when we use in our document, we should know where to use integration and where to use interoperability, so that we could not use them interchangeably. Thank you.
Thank you so much for the guidance. Much appreciated.
Thank you, Program Director, Dr. Mabuza from Eswatini. I would like to comment on the mutual recognition on the specialist training. I think probably as ECSA region, what we are lacking at the moment, it's the complete harmonization of our medical education. So the emphasis is more on postgraduate recognition, when actually even our undergraduate programs are not harmonized. So it brings a challenge, especially for national regulatory authorities, to ensure that we have that regional recognition and harmonization. Maybe we may need to add that in our document. Thank you.
Thank you so much. We take note of that.
Thank you, Chair. I also agree with the last speaker on the need to harmonize, especially including undergrad. Speaking from the Zambian example, in Zambia we are training a lot of our health workers now from the region, and so that requires that the training we are providing is accepted and is also fully recognized by the member states from which these students are coming from. Because, I mean, you can imagine parents sending students for 7 years and then their own country cannot accept them. So that is something that's going to happen, and will continue as we continue to share training platforms. That is not only going to happen to Zambia, it could happen within the region. So there is need for us to harmonize and standardize. So just supporting the last speaker. Thank you.
Thank you so much.
Thank you very much, Program Director. What do we do with the bulk of unemployed health workers now? Can we inject some language in maybe number 1 of the direction to the Secretariat, something about absorbing the current bulk of many unemployed health already trained, qualified, but they're not employed. I think that's our problem. I think we need to include that language in the recommendation.
Thank you for reminding us of the paradox that we are facing.
Yes, Chair. Again, to support that point, using the Zambian example, as you probably would read in the media, in the Republic of Zambia, especially for non-specialists, we have a lot of workers now, nurses, doctors, that obviously our wage bill cannot allow to absorb at once. I remember in the past when we had shortages of human resources in health, we agreed, even in the SADC, I remember that we shouldn't employ or take workers from each other. But that time is fast coming to an end. Most of our member states are now faced with a situation where we have a lot of health workers that we have trained and they're not employed, like my colleague has just said. We must now find a solution in sharing these resources. What we train in Zambia should not stay in Zambia. Other countries that need these workers should be able to take them. And so we must look at the things that we have put in the past, the roadblocks and, you know, the code that we've tied around ourselves to start releasing that so that we start using these resources. They are for the ECSA community. What we train in Zambia should be useful for ECSA. Thank you. We're already doing that at postgrad. That's why we have the ECSA colleges. And we can share these experts, you know, specialist trained, trained personnel. Why are we not doing the same with the undergrads? Because it's really bad that we should train so many people and then they can't even get employed, and yet the need is still there within the region. We would rather they stay in ECSA than go to India or wherever else they can go.
Thank you. I fully appreciate and understand your frustration. I have friends with master's degrees who are selling airtime right now. So colleagues, I would like to appreciate your inputs, quite a lot of inputs that came. The task at hand now is for us to consolidate all these inputs into the final document. We will include the comments that came from this room, and these will help us to fine-tune our approaches. We take note of the comments around the past resolutions and ensuring that they are also represented in future meetings, but we'll make the revisions and we'll make that information available. I only have one request that I'm making before I step down. Our document, we have finished going through the recommendations. My request is for an adoption with the revisions that we are going to make immediately after this session through the team. I am requesting an adoption of this document with revisions. With amendments, yes. Thank you, the right word. With amendments. We have a proposal. Seconder. Third. Many. Thank you so much. As the Director of Programs, I really appreciate the input that is coming through. All the comments that are coming in directly land on my table, and my commitment is to ensure that we improve this document according to the recommendations that have come out of this meeting, and we work together to ensure that we address the current challenges that we have in the region. The areas that need us to standardize, to work with the member states, we will work on that as the Secretariat, and we'll continue to engage with you. Our engagement with you is not just because we are here at the Best Practices Forum. Our engagement should continue well beyond this meeting because our work is not yet done. We have a lot of work to do for our people, and I appreciate you being on the table And I really want to continue on this journey with all of you. Thank you so much. I'll hand over back to the chair.
Thank you very much. I think another round of applause to Dr. Mungati. I think that was an awesome job to take us through such a large and complex document, but very efficiently. I would like to acknowledge the Acting Principal Secretary of the Ministry of Health who has joined us, Reverend Masilela. Sir, you are welcome, and the senior officials accompanying you. We will be quickly proceeding to the awards session, but before we do so, I have just a quick announcement regarding the arrangements for pickup to the airport. For those leaving on the 8th, which is, I believe, tomorrow, you are requested to be at the pickup point 2 hours before your flight time. So those with departure at 11, you'll be expected to be picked up at 9. Those going at 14:30, you'll be picked up at 12. Those going at 16, you'll be picked up at 14 hours. And those going at 17, you'll be picked up at 15 hours. But you are kindly requested to be ready at least an hour before pickup time, so that you don't, we don't have any delays in leaving the hotels. And then for those leaving on the 9th with flight time at 14:30, you are also requested to be ready for pickup at 12 hours. And then for today, for the excursion, the participants going to Mantenga, you are requested to carry with you a 150 of the local currency for entry. Please remember to just carry that little amount for you to enter. But for those going to Manzini Market, it is free. So depending on what you registered for. Right. We move quickly to our award ceremony, and as I mentioned a little earlier, we will be awarding the best oral presentation. That's category 1. We'll also be awarding the best poster presentation. That's category 2. And last but not the least, we will be awarding the young researcher. That's category 3. And to do this, it's my singular honor and privilege to call upon our dignitaries, the acting PS, as well as the Director General of the ECSA Health Community, to come up to the stage to make the awards. And also, let's give them a hand as they come. And also those from the Secretariat that are responsible for this session kindly come through. I believe you are supposed to be bringing the awards now, as the awards are announced. Okay, that's the grand entry of the awards. So beginning with the first category, which is the award for the best oral presentation, I am greatly delighted to, just pardon me very briefly. Just to make sure we don't make any mistake. Sebentile, please come through and just assist us with. Okay, I think we are good. We are good. So it's my singular honor and privilege to call upon the winner of the best oral presentation. This is Michael Mutamia, under the sub-theme Innovation, Health, Research and Development from JPIGO.
Unfortunately, Michael had to leave this morning, so it's my colleague that will give it.
Right, so please stand there. And his presentation was From Country Innovation to National Scale, Leveraging Heat-Stable Carbetocin to Advance Maternal Health Outcomes in Kenya. And his focus was on Kenya. And to receive the award on his behalf, since he has had to travel, I have the colleague to receive the presentation. Please go ahead and greet the dignitaries. Another hand, ladies and gentlemen. As you also carry Michael's. Thank you so much. Right. Another round, ladies and gentlemen. Next category is the best poster presentation. And this goes to Bekiwe Shongwe. The sub-theme was quality of care and patient safety. She represents the Clinton Health Access Initiative. The title of her presentation was Integrating HPV Vaccine into Routine Immunization of Adolescents Living with HIV, Eliminating Vaccine Stigma by Improving Demand Creation and Strengthening Healthcare Workers' Capacity. Congratulations. Please go ahead and greet our dignitaries. Right. So, another hand to them, ladies and gentlemen. The DG would like to say congratulations in Siswati.
Siyabongela.
Thank you so much. Thank you. Ladies and gentlemen, last but not the least, we have the Best Young Researcher. And this award goes to Nanyondo Amina under the sub-theme on sustainable financing and partnerships. And she's from the Free O2 Foundation. Her presentation was entitled From 51% Functionality to 96% Uptime, Government Adoption of a Private Sector Oxygen as a Service Innovation in Uganda. A hand to Nyantando. Kindly proceed to oxygen as a service. Really, really important concept there. Thank you so much. Another round of applause, ladies and gentlemen. Wonderful. That marks the end of our award giving ceremony. And I will be requesting the acting PS to take his seat, as I also invite the Director General to give his closing remarks. DG.
Thank you very much, Dr. Silumesi. Acting PS, Minister of Earth from the Kingdom of Eswatini, the Program Director, the representative of the government of the Kingdom of Eswatini and other governments present here, directors and senior officials from all our member states and non-member states, development and cooperating partners, researchers, academia, innovators, and health professionals, distinguished guests, ladies and gentlemen, Sanbonani. Bonjour. Bon dia. Habari za asubuhi. As we draw the curtain on the 16th Best Practice Forum, I'm filled with proud and gratitude, renewed confidence, and above all, unshakable hope. Ladies and gentlemen, over the past 2 days, we have witnessed the extraordinary strength, expertise, and determination that define our regional health community. We have listened to compelling evidences from across our member states, interrogated game-changing innovations, and engaged in a candid reflection on the challenges facing our health systems. Under our theme, Shaping the Future of Health in the ECSA region, Advancing Health Security, Innovation, and Sustainability, we did not merely discuss the future, we began to actively build it. We envision a region where access to quality healthcare is never dictated by geography or income, where health systems are resilient and prepared before crisis hit, and where African evidence shapes Africa policy, and where proven innovations are rapidly scaled across borders. This forum has proven once again that our region is rich in talent, ideas, and dedication. Our challenges now is to ensure that the brilliance-driven solutions do not remain trapped in the pilot projects. As oftentimes one of my friends says, that Africa is home to pilotitis. People are moving from one pilot to another without going into full scale. I believe this year's Best Practice Forum is going to put to an end that practice in the continent Africa. Ladies and gentlemen, the commitment is precisely what sets the ECSA Health Community Best Practices Forum apart. We do not gather simply to present research or innovations. We come together to identify what works, evaluate how it can be adapted elsewhere, and link evidence directly to the policy action. An idea shared here in parallel session today must become a regional policy, regional strategy, and regional guideline. And that's very important. This journey from evidence to impact, it embodied by this year's award winners, whom we had privilege to witness, from Mr. Michael Muthamia of Japaigo, Kenya, to Bekiwe Shongwe, and to Amina Nanyondo, who have demonstrated that most of the things that were able to be implemented in Africa were able to be implemented the people who are residing in the continent. To our award recipients, these honors are not the finish line. They are launch pad. May they open doors for further collaboration and amplify evidence that transform lives. We at the exercise community, we will take them as our models and make sure that we support whatever they are doing so that they can not only impact their organizations or their countries that are coming from, rather impact the entire EXA region and beyond. To Ms. Nanyondo and all our young researchers, do not await to inherit the future of health in our region, as the present and the future belongs to you. So you should enjoy. Being a young researcher, that is the best thing to happen to someone. So carry out that motto going forward. And congratulations to you once again. To every presenter, panelist, exhibitor, and innovator, through only 3 awards were conferred. Although there were only 3 awards conferred, every single contribution has enriched our collective strength. Now, as we return to our home countries and institutions, the true test of this forum begins. The real measure of our success will not be the number of the speeches and the presentations that were given here. Rather, how do we translate the speeches and discussions that we have had in the past 2 days into lasting impact? We will follow up on the partnership forged here, and we will make sure that whoever attended in this forum will remain abreast of what is happening at the EXA region. I urge every delegation to take the lessons relevant to your national priorities and translate them into immediate practical steps. EXA Health Community stands fully prepared to facilitate technical exchange, drive policy dialogue, and champion South-South collaboration. Although now we have a number of colleagues from the global north, so we are also embracing the South-North collaboration. No single country needs to solve these challenges in isolation. When Kenya develops a strategy that protects mothers, the region must learn from it. When Eswatini finds a stigma-responsive way to reach adolescents, that model should travel across all EXA member states. When Uganda builds a resilience oxygen system, others should be able to adapt it. This is a regional cooperation and is the most practical, human, and powerful form. I extend our deepest gratitude to the government and the people of the Kingdom of Eswatini for the warmth and the generosity that have accorded to us. My sincere thanks goes to all the member states who are here in today, our esteemed partners, academia, civil society organizations, and the private sector for their unwavering commitment and support. I also want to recognize our scientific committee, reviewers, judges, moderators, rapporteurs, interpreters, organizing team, and dedicated EXA Health Community Secretariat staff. Your hard work behind the scenes made this event very successful. As we conclude, let us remember the human hearts at the center of all our efforts. The mother seeking a safe delivery, the adolescent deserving dignified preventive care, the newborn relying on functioning oxygen, the health worker needing proper tools, and community trusting us to protect their health. Let us take this evidence home. Let us nurture this partnership. Let us invest in our innovations and give our young leaders room to lead. Above all, let us transform our shared knowledge into decisive action. The challenges before us are immense, but the unity and determination shown in this room give me absolute confidence in our shared future. May the 16th Best Practice Forum be remembered not only by the knowledge that was shared, but for the transformation it has had to all of us. And I once again repeat to thank the team from the Kingdom of Eswatini, who were our hosts, for the tremendous work they have done. We enjoyed every single minute of our stay at the Kingdom of Eswatini. But I also like to thank each and every one of you for having made it to this forum. I know some of the people traveled miles away, 16 hours, 20 hours to attend this best practice forum. We don't take that one for granted. We really appreciate, and we once again welcome you for the upcoming Health Ministers Conference to take place in the beautiful city of Kampala, February next year, where you'll have an opportunity to see whatever you were able to discuss here, to deliberate here, being changed into resolutions to be implemented again for the next 12 months. So that's a huge opportunity, and that's why Excite Community is a unique organization. All the decisions that are made at Access Community, even the resolutions that are made, they are not just made by the ministers of health. They emanate from us, the technocrats, researchers, academia. They go into the Directors Joint Consultative Committee, then to our principal permanent secretaries, then eventually to our ministers of health. So that is going to be something which I wish every one of you get to witness how ECSA comes up with the resolution. But I also want to announce to you that ECSA Health Community is working with the government of the United Republic of Tanzania in hosting the second International Primary Healthcare Conference to take place in Arusha, Tanzania, from 9th to 11th of September. That is next month. So we also like to see you all there. If you get time, please don't hesitate to come and see what we'll be discussing as far as the primary health care is concerned. And it will bring the people and the delegates from all over the world to discuss issues relating to primary health care. With these words, it is my distinct honor to declare that the 16th Best Practice Forum officially closed. I wish you all safe travels back home. Long live regional cooperation. Long live East, Central, and Southern Africa Health Community. Asanteni sana kwa kunisikiliza. So, the forum is officially closed. Ngiyabonga.
Just a quick announcement, ladies and gentlemen, for the DJCC members. The meeting will be in ballroom 2. The meeting will be in ballroom 2. Speaking. Ladies and gentlemen, kindly take your seats. Kindly take your seats briefly. Ladies and gentlemen, sincere apologies, a little diplomatic glitch, but we sincerely apologize for that. As you have noted from our program, we will have the final closing by the Ministry of Health of the Kingdom of Eswatini, and I am delighted and humbled to call upon the acting PS, Reverend Masilela, to come and give his remarks. A big hand to the PS.
Colleagues, good afternoon. A very good afternoon, colleagues. Are you already homesick? Oh, it's still the morning. Okay, okay. Program Director, Honorable Member of Parliament, Honorable Tsembeni Makongo, I have to do an interjection on this one. We are very honored to have you in our midst for honoring our invite and being here, not just as a member of parliament, but vice chair of the Health Portfolio Committee. So a round of applause for her, please. Dr. Ntuli Habolongwe, Director General of East, Central, and Southern Africa Health Community. A representative from AUDA, NEPAD, Directors of Health Services from the various member states, senior government official here present, institutions under ECSA, College of Health Sciences, distinguished partners, researchers, innovators, academia, professional associations, and representatives of the private sector, distinguished delegates, members of the Fourth Estate, ladies and gentlemen. I'm not too sure whether to say good afternoon, but you've already corrected me. It's still a good morning. Today, as we conclude the 16th ECSA-HC Best Practices Forum and 32nd DJCC meeting, I would like to express the Minister of Health's sincere appreciation to all delegates, presenters, moderators, partners, and ECSA-HC Secretariat for making this gathering a productive and inspiring one. In his opening remarks, the Honorable Minister of Health in Eswatini and Chairperson of ECSA, Honorable Mtutuzi Matsebula, reminded us that the value of this forum would be measured not by the number of presentations delivered, but by the decisions, partnership, and actions that follow. After 2.5 days of rich deliberations, 3 messages stand out. 1, shared challenges require shared solutions. Regional cooperation, mutual support, and timely exchange of knowledge and expertise remain essential to address the numerous health challenges facing our countries. Remember, shared challenges require shared solutions. Number 2, lessons must lead to action. We must adapt the promising practices and innovations shared during this meeting, scale what works, and translate our commitments into measurable improvements in people's health. Lessons must lead to action. They shouldn't just remain lessons. Thirdly, health security can be achieved if individual member states prioritize financing for health to build resilient health systems that incorporate primary health care approaches. The closing of this meeting should therefore not mark the end of our engagement. Rather, it should signal the beginning of deeper collaboration among member states, technical institutions, development partners, researchers, and health professionals and communities. Maybe if I may quote Honorable Tsembeni Makongo verbatim, one would say, the fact that you have gathered here, please, it shouldn't stop at just being a gathering. It should lead to fruition. It should bring tangible and positive results. That is her word verbatim. And that, as a parliament, or as parliaments, or as parliamentarians, they will always support. On behalf of the Minister of Health and the government of the Kingdom of Eswatini, I thank you for your active participation, openness, and commitment to improving health across our region. May we leave Manzini with renewed purpose, stronger partnership, and a shared determination to turn the lessons of this meeting into lasting progress. Please take the opportunity to visit Mantenga Cultural Village. As I've been told that there is a team that is going to Mantenga, and then there's another team that will be going to the Manzini market and nearby Manzini shops to grab some souvenirs from our kingdom. Not just only souvenirs, even to grab things that will help you, even back home. I wish you safe journeys as you return to your various destinations. Hambani kahle, kwaheri. I thank you.
For the DJCC members, I think we'll only have 15-20 minutes tea break, and then you'd be expected to come up for your closed session in ballroom 2. Kindly keep time so that you could also finish on time. For everyone, it's been a great pleasure having you in this meeting, and we wish you safe travels as you get back to your various destinations. Thank you so much. There is a QR code for the post-BPF evaluation. Please kindly just scan it and answer a few questions to help us improve for the next sessions to come.